Who's heard the term peripheral neuropathy, first of all?
Oh, I
All right, good. So sometimes people aren't even really sure what a peripheral neuropathy is. But there's really two parts. Well, there's more than two parts, but you can divide the nervous system into two parts: the peripheral nervous system and the central nervous system. Okay, so the central nervous system is the brain and spinal cord. CMT generally does not involve that. That's a good rule of thumb. All right, the peripheral nervous system is where most of the problem lies, and the peripheral nervous system is everything outside of the spinal cord. Okay. So, and that involves nerves that are motor, those that make you move, the sensory nerves, those that allow you to feel, and even the autonomic nerves, so nerves that you don't even think about, that control your heart rate, your blood pressure, your digestion, everything like that. So autonomic things, that's part of your nervous system as well, part of your peripheral nervous system. If the motor nerves are affected, you get weakness. If the sensory nerves are affected, you can get numbness. We're typically taught in medicine that CMT patients don't really know that they're numb and they don't have pain, but we know that's not true.
I broke my wrist and I didn't even know it.
Yeah.
It didn't hurt.
Yeah. Sometimes they.
Sometimes it's beneficial.
Right. Yes. And sometimes it can be harmful. You know, you cut your foot and you don't even know that you're bleeding until you look down and see it. And then if you have autonomic effects on if the peripheral nervous system, the autonomic system is affected, you can get drops in your heart rate and problems when you stand up. You get lightheaded, you faint. Some people get constipation, nausea, vomiting. So these are different things that can manifest depending on what part of the peripheral nervous system is affected. So that's the peripheral nervous system, all right? And now we're going to sort of take a magnification here, right? So this is the same system here. We'll just magnify the sciatic nerve, all right? And it's a big, thick rope, and within that rope there's little threads, okay? And if you pull out a single little thread, you come down here and you have the nerve, all right? And the nerve, actually, the cell body, lies up in your spinal cord. And it goes all the way down into your toes, all right, or all the way down into your fingers. So it starts up here, so it's a very long cell, all right, and it goes all the way down into your fingertips or to your toes. And it looks like this. If we magnify it, you can think of your nerves like a wire, all right. You have the insulation around the wire, the rubber coating around the wire, and then you have the copper wire itself, okay. There's a number of things that can damage both the insulation around the wire or the copper wire itself, all right? And there's different types of CMT can affect either the axon, which is this here, what I'm referring to as the copper wire, and other types of CMT. The type 1 tends to affect the myelin, or the covering around the nerve, and type 2 tends to affect the axon, or that copper wire. All right, throwing lots of information at you. But there's tons of things that can actually damage the nerves. And so in a person's attempt to obtain a diagnosis, they often go through a lot of blood work, nerve conduction tests, and things like that most of you have probably gone through or know someone who's gone through. All right, we generally have this little mnemonic here of vitamin, all right, C and D. There can be, if we go back, you can see that within the nerve here, you have blood vessels. So this is living tissue, so it needs a blood supply, oxygen and nutrient supply. But so there's vascular problems that can cause nerve damage, inflammation, and idiopathic is a fancy name for we don't know what's causing it. Trauma, obviously there can be direct trauma to the nerve. Toxic things, everything from certain chemotherapies to certain vitamins can be too toxic. So too much vitamin B6, everyone thinks, oh, vitamins are fine. That can't damage the nerves. Most of that is true, except vitamin B6 is a tricky one. Too much, over 200 milligrams a day.
What about B12?
B12 is fine. You take all the B12 you want. But B6, over 200 milligrams a day can actually damage the nerves. But if it's too low, it can also damage the nerves. So that's a tricky one. Everyone's checking what B vitamins they're taking now. But there's other toxic things that we're exposed to all the time. Certain chemotherapies, certain heavy metals. If you have well water with lead in it, or an old house with lead pipes, all these things can affect the nerves. Okay. Autoimmune. So there's autoimmune neuropathies. Metabolic problems. So if there's kidney or liver problems, all of these things can come into play with neuropathy. So sometimes getting a diagnosis of CMT, unless there's an obvious family history, can be difficult.
Yeah.
Certain infections. Lyme disease in this area is probably the big one that everyone's heard about, but there's a number of infections that can affect the nerves. Cancers or neoplasms. Sometimes in the body's attempt to fight off certain cancers, they make these proteins called antibodies, okay? And these proteins can sort of attack the nerves as collateral damage. It's in the body's attempt to fight off the cancer, the nerves are collateral damage. So all these things are, they usually present differently, but things that your doctor, believe it or not, is quietly considering as you're talking. And then congenital or genetic, that's what you guys are here to talk about. And certain drugs are also toxic as well. So I pulled this from one of my slides to teach the residents about probably the host of blood tests that we can order. A lot of times people, I've heard patients say, well, I had blood work and they didn't pick it up. Well, you definitely didn't have all the blood tests available, all right? So we usually check some very basic things, but there are...
Now, why is that? Can't they pick it up?
Because we have to actually be looking for
That's
it.
why I'm saying, my son went through about 5 to 10 different blood tests.
Oh, I believe it, yeah. We have to be looking for it because some of them have to be drawn and preserved in certain tubes and prepared certain ways. And if it's not done in that tube, and if we're not looking for it, we just won't see it. If you don't look for it, you don't find it. So you have to suspect it first before you can actually look for it. But a lot of times, you guys have probably noticed that, haven't you? Well, I had blood work, and my doctor didn't say anything. Go ahead.
In order to have a blood test to find out if you do have CMT, is there a specific thing? Like, I've never had, we have a family history,
Mm-hmm.
but I've never had it done specifically just for me. So if I wanted to have it done, could my internist do this test, or do I have to see?
He could, but we'll, because there's so many different types of CMT,
Right.
you need to know which one you're looking for. And we can get to that in a little bit. But he could, if he knows which one he's looking for, he could simply just order the test, absolutely.
So if I go based on my family history
Uh-huh.
and ask to have the test for CMT 1A,
Yes, that's
then
by far
you
the
can
most common.
specifically test for that?
Yep,
Okay.
absolutely.
Okay.
And that's just,
And if it comes back negative, then I know I have a different one.
right.
Or-
Right.
okay.
Well, it depends on how they run it. If they sequence the whole gene, or if they just look for common mutations.
Can you give me like the exact test that he has to run so that I can ask him for
Yeah.
it? Or-
Yeah. Absolutely.
Okay.
Yeah. And so these are, and guys continue to chime in. So how many of you have had nerve conduction studies? Yeah. How fun is that?
Is that what you put on your leg?
Yeah, the shocks.
Yeah.
That's the nerve conduction study part of it. A lot of people refer to it as EMGs, but EMG is actually more the needle portion of the test. Yeah, that's the needle. Yeah. If you're lucky, you get both in the same day.
What's the needle one? What kind of?
The needle, there's no shocks with that, but we're listening to the muscles, believe it or not.
See, when they pricked my son with the needles, he felt nothing.
Yeah. Were they pretty
They
distal?
were under his foot.
Yeah. So his nerves weren't sending the signals to his brain to feel it, which is probably a good sense in that when they're sticking the needles in there.
See,
anyway.
but then again, I think he had some kind of infection on his foot. So I don't know if he got cut, if he stepped on a nail. He didn't know about it.
Yes, right. That's the dangers of going barefoot and things like that, because I've had other patients who, in the middle of summer, have walked out to go and get the newspaper, walk out onto the pavement, and by the time they make it out back to their house, the skin is sloughing off the bottom of their feet because they fried their feet on the pavement and they didn't even realize it. So it's things that you need to be aware of. A lot of times patients will come to the doctor complaining of pain, but they don't come complaining of numbness often. Sometimes they do, but more often pain will drive you to the doctor. A lack of something is easy to ignore,
Yeah.
So this is what a nerve conduction study looks like for those of you who've never had it. And basically it's small shocks to the nerve, and we're measuring the response at the nerves and muscles. And these waveforms mean things to us, and there's no normals for every nerve, okay? And in general, you know how I said CMT can affect the axon, the copper wire, or the myelin, the coating around the nerve. If the velocity is slow, it's usually a myelin problem. So if the time for all this is conducting is slow, which is this case here, then it's usually a problem with myelin. If the amplitudes are down, that's usually a problem with the axons. Okay, and there's exceptions to every rule, of course, but that's a good rule of thumb, and that's one of the things we're looking for. And this is one of the ways to sort of differentiate what test to send. Okay.
Question, does
Yeah.
the doctor know what tests to offer?
A neurologist should. I'm not sure certain primary care doctors very well may, but they may not see it enough to be familiar with it. Just like, I'm not familiar enough with things they see on a daily basis.
Right. If I came to you just like, say my feet hurt, and you notice that there's physically did a different shape.
Yeah.
So now how would you know what to test?
I'd probably usually I start with the nerve conduction study, because then I can sort of do a branch point
And
from
then
there.
you continue going on until you find.
Right.
So,
And usually the basic blood work that we run is the things that are reversible first. So we don't want to miss something that's treatable, like a B12 deficiency or an abnormal protein in the blood that may signal something like multiple myeloma, believe it or not. So all these things we generally, a type of cancer, all these things we generally look at first and foremost.
B12 deficiency.
Yes.
Because they told my son to start taking B12.
Yeah. So they might have suspected that in him initially. I'm not sure. I'm speculating.
Probably correct.
Yeah. This sort of comes by the wayside now. We don't really, we don't need to do nerve biopsies anymore to diagnose it. But occasionally, this is what you would see on a nerve biopsy. So the myelin, this is taking that nerve in cross section. So it's coming out of the screen at you, and you're sort of cutting it and looking at it. And usually the myelin, the coating on the nerve is nice and tight, wrapped like this. And here's the axon in the center. Well, in a patient with CMT 1A, where the myelin is affected, it looks like what they call an onion bulb, okay? Have you heard this term before, maybe? And you could see it's all loosely sort of wrapped around the nerve, okay? And that affects the speed at which the nerves can conduct and the health of the nerve, okay?
If it's the axon that's affected, does the axon look different?
Yeah, the axon does look different. I didn't put that one in here, though.
Just curious.
Yes. So the inherited neuropathies, there's tons of them. CMT1A being the most common. And believe it or not, in the UK, there's a inherited neuropathy clinic. So that's all they see is CMT patients, okay? And they took 1,600 consecutive patients, all right? And tried to establish a genetic diagnosis in these people. And what they found is that over 90% of them, let me step back. In about 2/3 of them, they could establish a genetic diagnosis, okay? Of those 2/3, 90% of them fell into one of 4 gene mutations, or mutations in one of 4 genes, okay? CMT1A is PMP22, maybe you've heard of it, maybe not. CMT1B, that's another common one. And the X-linked CMT, so CMTX, and the CMT2A, it's a mitofusin gene. That only accounts for about maybe 35% of type CMT2s, though. So, okay. So generally, there's and they proposed an algorithm, which basically took a patient who you suspect has CMT, and you do that nerve conduction study. If it looks like it's more a problem with the myelin, you test the ones that affect the myelin first, the most common ones, CMT1A and 1B first. If it's more an axon, then you check that mitofusin gene. So this is where, if he orders the correct test, they can, get the answer more often than not. Okay. This is just showing some of the genetic tests. Sometimes there's actually panels that are available. So if they're not really sure what they're ordering, they can just order an entire panel, which is very expensive, and sometimes your insurance companies will balk at it. But then they can tell you if there's any abnormalities in any of the genes that they sequence. Yeah, go ahead.
What's the significance of knowing which type you have?
Yeah, that's a great question because there's no cure. So why get a genetic diagnosis? How do I know that'd be the next question? Right on cue. So I think for a lot of people, just knowing the cause of their condition provides some validation for their symptoms. You can get prognosis and progression with certain mutations and certain types because some of them will, this is more in like the CMT type 4s, but it can involve other things, sometimes the breathing muscle and things like that, okay? That's a rarer type, but if you have a genetic diagnosis, these things you can start to think about, okay? Family planning. So generally young couples tend to want to know. It may not affect anything that they would do one way or the other, but just to be prepared when you're planning a family, okay? And probably one of the biggest ones is trial and treatment eligibility. So unless you have a genetic diagnosis, getting into a trial may be difficult, okay? Because often there aren't too many targeted therapies right now, but when there are targeted therapies, knowing your gene defect that they're trying to target is going to be key, okay? The cons, it's expensive. There's really no immediate health or benefit to the individual being tested often, because right now, like I said, there's no cure, okay? And I always address this with my my patients. They can't be discriminated on the basis of health insurance from a group or anything like that, but the Genetic Information Act does not protect individuals against long-term care insurance, disability insurance, or life insurance. And I only say this is because I've had patients who get a genetic diagnosis of CMT, and even though it's not going to affect their lifespan whatsoever, they can't get disability insurance, life insurance, long-term care insurance. And I could write letters to them blue in the face. They don't care. They don't want to take on that liability. And I only know because it's happened. Okay?
I just had a couple of pros.
Yeah. Yeah, add them,
If
please.
you want to become a member of the MDA and
Mhm.
receive part of their benefits, you need to also have a genetic confirmation.
Okay.
They ask for that, right? I know that was the case with me. I don't know if anybody else is a member
Remember what?
of the MDA. Yeah. And then also, if you want to receive any benefits for disability or anything like that, you also need a confirmation of your condition.
Okay.
Yeah.
That makes sense. Questions? Lots of information here. And this is the Genetic Information Non-Discrimination Act. This is just what I said, that can't be used to prohibit health insurance or employment discrimination, but it doesn't protect against those other things. And it also bars employers from using genetic information in making hiring, firing decisions. This was made in 2008. This is called GINA, or Genetic Information Non-Discrimination Act. So those trials that we discussed, have you guys ever heard of clinicaltrials.gov? So this is a website that anyone can go to, all right? And you just punch in your diagnosis, or for certain muscular dystrophies, for CMT. So just last night I just punched in CMT and I came up with like 280 studies, okay? And some of them aren't recruiting, some of them are closed, or results are pending, or active but not recruiting, etc. But so I eliminated all those, and all the recruiting ones, or about to be recruiting, there was 70 of them, just with the search criteria of CMT. Yeah.
I just saw Michael J. Fox on Good Morning America the other day saying that something like 40% of all clinical trials can't find people to be in them.
I believe it. And sometimes it's an access issue, meaning patients are far away, but a lot of times it's that they don't even know about them. So clinicaltrials.gov, you could just check it out and see if there's any trials in your area that are, it's more information for you guys, okay?
.com or .gov?
.gov, G-O-V, yeah. Clinicaltrials.gov, right up here. Okay. And that's basically it. I just wanted to give an overview and then sort of open the floor up to questions, because there was a lot of information there. Yeah.
Is there any literature about, it's an inherited disease, but where did it originally start?
The
Or
original one.
have people just been suffering for it for hundreds of years and not even known it?
Likely.
Yeah.
Yeah, it's always existed, and it's the CMT 1 and 2. Most of them are autosomal dominant, which means that offspring have a 50% chance of getting it. So I haven't seen anything about the original mutation. There's certain muscular dystrophies and things like that. They can trace it back to an area,
Right.
but I haven't seen it. I'm not saying it's not out there, I just haven't seen it. Yeah.
Have you seen gastroparesis specifically in your CMT patients?
I haven't. I've seen it with a lot of certain muscular dystrophy patients. I haven't seen it too much with my CMT patients. I gotta say, my CMT patients, often they get diagnosed and then they don't follow up so regularly, which is fine. Right, exactly. And maybe they just address it with their primary care physician. So I can't say that I see that often, no.
What is that?
Yeah.
It's low digestion when the food doesn't move through your stomach and through your digestive system properly.
Mhm.
Oh, is that CMT too?
Well, no, it's gastroparesis, but
Yeah,
I saw
my daughter-
digestion is.
My daughter does that.
Yeah, I'm not sure if it's CMT related or
Yeah.
not.
It can be related to a lot of things,
Yeah.
you know, so
Yeah.
it's hard to know.
It's funny you should say that, she was just, nobody could find out what was wrong with it.
Doctor just found out.
Yeah.
You know, CMT is supposedly affects you from the elbows down and from the knees down.
Yeah.
But I noticed, you know, my thighs are getting weaker. You know, is that because of atrophy because I'm not able to use those muscles because of the CMT, or is there effects further up?
Yeah, well, it's generally affects distal to proximal. So, you know, it tends to start in the distal feet, and then it, you know, slowly sort of creeps up. So patients will notice a foot drop first, and so then walking becomes an effort because, you know, usually we have to keep our foot up during that swing phase so our toes don't catch. But now when they're dropping, when your toes hanging, you have to lift your leg up higher each time, just so you don't trip, and you have to clear that toe that's sort of hanging there. So that's some of it. When it starts to affect generally up around the knees area, you know, the length of the nerves, generally the hands start to be affected. And it usually continues to progress. But usually most of my CMT patients at least are ambulatory, you know, whether it's with braces or what have you. But so it can affect the proximal muscles as well, but it's not to as great of an extent.
Would you say generally using the muscles more would help? Like the more you can use them, does that have an outcome where it helps you or will it hurt you?
So I do think physical therapy and things like that
Just
help.
walking as much as you can.
Right. So now it won't alter the course of the disease, but there's many other benefits, right? So the joints stay mobile and you don't get frozen joints, and then compounded with orthopedic problems and things like that if you're active. So while the physical therapy won't affect the nerves, long term your mobility is going to be prolonged and improved. Yes. So
I was better when I was able to go to the gym.
right,
A lot
right.
better than I was when I was able to go to the gym all the time.
Yeah.
It was 4 or 5 times a week.
Absolutely.
I was a lot better than I just got worse. I can't go because I
Right.
fall.
Yeah. Yeah.
I notice as I get older, I'm getting a lot more numbness in my hands right now.
Oh, yeah.
My hands are very, very numb. You know,
Yeah.
I'm constantly rubbing them. In the wintertime, forget about it. When they get cold, I can't do anything. But
Yeah.
what is the numbness? Is that anything you can do about it, or is it common?
Well, there's not too much you can do about it. Yeah. We have a lot of medications for other neuropathies, but they're more for what we call positive symptoms. So that burning, tingling that's there. For the negative symptoms or lack of feeling, numbness, there aren't any good treatments for. And yeah, unfortunately not.
I just went to the hospital. I was in the emergency room. I'm just wondering now that you're saying that it has to do with the pelvis. I had a horrible, horrible pain into my thigh, and then my back was out. I never know whether it's CMT or if it's the arthritis. And they couldn't diagnose me. They did all kinds of tests on me. I went out with the same pain I went in with. Woke up the next morning, the pain was gone. Could that have had something to do with it? Should I not worry about it?
Could that have had something to do with the CMT?
With the CMT?
I don't think.
Where the pain was in the back, and you were saying with the pressing.
Right.
I just wondered if that had something to do with that.
I don't think in that case. I mean,
Okay.
this is not having examined you or looked at anything
It went
they did,
away.
but
Just
yeah,
as
well,
fast
that's
as it came.
reassuring. Now, occasionally in patients with CMT, the nerve roots where they come out of the spine, they can, what we call it, say hypertrophy. They can get fatter, okay? And when they're trying to squeeze out of the holes of the spine, they can sort of get pinched, and that can cause a lot of pain.
That's what I have. I
Right
have
here?
Well, it can happen anywhere along the spine, really. So, and not all patients with CMT get it, but it has been
I
described.
have arthritis of the spine. plus-
Yeah, so arthritis can certainly cause pain.
Not fun.
Is it common to have one side affected more than the other?
I mean, we always say symmetric, but often there is subtle differences between one side and the other. Yeah, yeah.
Right is worse than the left.
And not only that, usually patients are more sensitive to that than our sort of crude tests of, push, pull. What you're doing every day is more sensitive, and plus you're getting that feedback. So,
Why would that be though? Is it the one side of the brain versus the other or something though?
no, I don't know. I'm sort of thinking out loud here, but I'm wondering if one side has just developed better coping strategies for the weakness. I don't know. I don't know why sometimes there's a little bit of asymmetry. But which hand?
My right hand and left, right hand and right foot are worse than my left.
And you're right hand
I'm
dominant?
right-handed.
You're right-handed?
Yeah.
Mine's the same, me too. I'm opposite.
Yeah.
Mine's
And then,
my left.
then
But we're twins, so I'm thinking maybe she got the right, I got the left.
then you got to wonder if it's only because you're using your right hand more, so you notice it more. It's hard to.
Yeah.
I'm guessing.
Yeah.
I'm guessing.
Wondered.
Yeah.
That's interesting, she mentions that because I'm right-handed and I can do more with my left hand than I can do with my right hand as far as picking things up or
Really?
if I have to
Yeah.
do something, I tend to use my left hand where I'm right when I have to write. I naturally
Right,
use my
right.
right hand and it's kind of strange.
Right.
And I find that my left leg is better than my right leg. I tend to drag my right leg left a lot more than my left leg.
Do you find that to be true? Can you burn out your muscles if you work them too hard?
Yes, the fatigue is a big issue, as everyone's nodding their head here. and then sometimes, you often have to worry about damaging the nerves and tendons and muscles as well, so from the overuse, because those muscles are weaker. Even though it's a nerve problem, once the nerve gets damaged, the muscle is affected as well.
But
I
it's
see if
not
you
actually
noticed.
the muscle tissue burning out. I was told by one doctor that if I continue to work out, I'll burn out the muscle tissue.
Well, so when the nerve dies, okay, or is damaged, it slowly starts to die back. And when that happens, it disconnects from the muscle, okay? Because it's a very long nerve, right? It starts up in here and goes all the way down, and it slowly starts to disconnect from the muscle. For a time, the existing nerves can sort of compensate. They branch out and try and reinnervate that muscle. But after a while, because the process is always continuing, that compensation mechanism breaks down. And what happens is then the muscle starts to atrophy and get smaller. And that's what you guys have noticed over time, I think.
Do you have any patients that take the drug called Novigil that's supposed to help with chronic fatigue?
I do. I don't have any CMT patients on it, but
Do you know if it helps them?
yes. So I've used it in patients with things like ALS, certain muscular dystrophies, because all of these things have a unifying component of fatigue, and sometimes that's one of the most debilitating symptoms.
So what do you use for it? I didn't hear.
She mentioned Nuvigil. Provigil is another.
What is that?
It's a stimulant. Modafinil, it's also called. and there's side effects to it, but usually the patients that I've had on it actually like it and stay on it.
I just
so.
tried getting it from this new pain management doctor that I went to, and I just found out today that my insurance didn't approve it. Is there any reason for that? Is
Yeah,
there
so
very-
it's not because it's not FDA approved for it.
Okay.
So we often use things off-label, and then what the trick is, it doesn't always work. I've had mixed success. Is writing a letter to the insurance company with medical literature to back its use. So even if it's off-label, if you can show that it's benefited in certain populations to treat the fatigue of this diagnosis, I can often get it overturned. But it's takes effort.
Speaking of,
Yeah.
I was just wondering, because I just went to a pain management guy
Mhm.
in Trumbull, I was wondering if at the hospital, if there is a group that is familiar with CMT and if there's anybody there that you might recommend.
A lot of our patients end up going to Longworth, but I think that's just because it's so close. And there's a group out there that does pain management. And so we have to send a lot of our patients there, not necessarily just CMT patients, but a lot of patients from our neuromuscular clinic. So
They would be familiar with neuropathy pain.
yes, definitely.
So maybe I'll see how this guy works out, and
Yeah.
I'm going to see you in July
Yeah.
again, so I'll get
The important thing, no matter where you are, and this goes with all your physicians, is that you're comfortable with them. If you're comfortable with them, great, you stay with them.
Is there any kind of database that we could have access to of people around the state that know something about CMT? Because you might be looking for a podiatrist to help you with your feet, or a physical therapist. And my experience is you go in and they go, you say, I have CMT, and they go, oh yeah, I heard about that in med school. Or, let me pull out my book off the wall, and you're not going to get much from those people. So
Often I found that the patients are my best teachers for that. And I often ask them what they've found or who they've heard about, especially if it's not around the immediate New Haven area.
So as far as you know, there's no place, like I live in Trumbull.
Not that I know of. Yeah, so you're down in Fairfield County there.
Right.
I'm sure there is. I'm just not aware of how you'd find them, unless they're advertising it.
Right.
As we get older, our cholesterol is increasing, and we have, like I'm on Lipitor, statins, and, looking at the list of drugs that could hurt us, I have to take it, and
Right.
I've talked to my doctor about it. What is your feeling on statins?
So statins are very good medication, and we're always trying to weigh the risks and benefits of every medication, not just statin medications or cholesterol medicines, but if your cholesterol is high enough that it's putting you at risk of heart disease, even though I'm a neurologist, I have to consider the whole person. So we don't want to put you at unnecessary risk either. If you take the statin and then you're not tolerating it for one reason or another, that's another story. But if you're taking it and it's lowering your cholesterol, then overall it's beneficial to you. The benefit's going to outweigh the risk. Absolutely.
What is statins do? I mean, they work on
Yeah.
as a neurologist type of.
Well, they inhibit a certain enzyme that decreases the production of cholesterol. Okay, so a lot of times, you guys may have noticed, I'll try and diet to lower my cholesterol, and you diet and you try the oatmeal and you try the Cheerios and it drops a couple points, but it doesn't change that much. It's because even though you've decreased your cholesterol intake, your body can make it, unfortunately. So
why are statins bad for a neurological problem?
Well, it tends, in certain patients, it can affect the muscles, okay? And there's a little powerhouse in our muscle cells, it's in most of our cells, called the mitochondria, and it's believed to affect that. And so the muscles can be affected. Sometimes patients have had what's called rhabdomyolysis, so the muscle starts to get damaged, and sometimes it's to the point where it can damage the kidneys, and your urine will turn a dark tea color or Coke color, and that can be alarming. It's rare for that to happen, but that's sort of the danger with the statins.
So is there some way for a CMT patient on statins to have their muscles tested?
Yeah, usually it's just a blood test, and they look for your muscle enzymes in your blood.
Do they do that when they do the 3 month, I mean, a regular
Usually they do, yeah.
primary care?
Right,
Oh, okay.
absolutely. And now, sometimes it's normal to see a little bit of an elevation. If it's elevated, we always say treat the person, not the blood level. If you're taking it and the blood level's a little elevated, but you feel fine, yeah, he's not going to change it.
Good. Thank you.
Yeah.
Are there any cases of people treating their CMT to lessen the effects of it? I know it can't be cured, but with alternative methods, have you ever heard of anything being helpful, either diet or lifestyle-wise, to, again, lessen the effects of it or at least slow the progression of it?
There's been some, who's heard about the vitamin C stuff? Yeah. So there was some interesting promising evidence in the animal models with high doses of vitamin C. And they did try it in kids with high doses just to see if it was tolerated, because the high doses that they were using can really cause some GI effects. Because it is an acid, all right? Vitamin C is an acid. And there were some modest effects. It didn't reach the end points to say that it was effective, but that is one of the things that was probably more recently out there. If it was a larger study, would it have picked up an effect? It's hard to know. Yeah. That's the only one that I'm familiar with, or I can come up with off the top of my head, though.
How about lion's mane? Have you ever heard of that? It's a type of mushroom.
Haven't heard
That's
of it.
supposed to help rebuild the myelin sheath. I've read this many times. Not
What is it called
specific-
again?
Lion's mane. It's a type of mushroom.
Yeah.
That again is supposed to help rebuild the myelin sheath, but it's not specifically been used for people with CMT. But
I
we
see.
thought, well, why not give it a try? you
Right,
know?
yeah.
But we haven't been doing it very long, so I
Yeah.
don't know.
Where do you get that?
You can buy it online. You can research it online too, from reputable sources. And again, I don't know if it's working or not.
Yeah, I
Just
haven't.
try
I
to
can't
figure
say
it
anything
out.
about it. I'm not sure.
Yeah.
And
The mushroom?
Yeah.
I'm not sure, to be honest with you. But it's considered an herbal extraction. It's been used in traditional Chinese medicine for thousands of years,
Yeah.
according to what I've read. And, we figured it's worth a shot. We don't know.
Anything's worth a shot.
Yeah, we don't know if this is the myelin sheath or the, what is it called, the axon.
right, axon. That's right. You got it.
Yeah, I wrote it down. But we figured, well, not knowing that, it can't hurt to try this,
Right.
So, just something.
Maybe it's something that builds up over time, so.
Yeah,
Also, I
yeah.
feel like if you like being active on coping, in my mind, would help too.
Mhm.
Like if you're sitting around doing nothing, what's gonna happen is gonna deteriorate more.
Yeah, well,
Using
find
it,
general-
hopefully it'll help. Who knows?
Is there anybody in Connecticut at Yale or UConn that's doing any research or any trials in the CMT area?
There's not anyone at Yale that's doing CMT trials right now. We're doing a couple other things, but not with CMT. Because our patients don't follow up. No, I'm only kidding. The other, there's another great neuromuscular group here in Connecticut, the Hospital for Special Care. I don't know if any of you see Dr. Felice or Dr. Whitaker. They used to be up at UConn. Maybe you saw them up there, got diagnosed in their photo. Yeah, yeah. He's excellent. Yeah. So, and I don't believe they had. Their trials are more focused towards ALS. I'm not. So I don't think there's any CMT
Where are they
trials there.
located?
They're in New Britain.
New Britain.
Yeah.
That's what it says. ALS, what's that?
That's Lou Gehrig's disease.
Oh, okay.
Yeah.
I can tell you, the doctor told me when the Frank first was diagnosed, and maybe this will help you. The doctor told me when I was diagnosed that I should be on my deathbed. But for some, yeah, I know, wasn't that nice of him? But anyway, but.
I've
so
never
when-
told a
what
patient
What he said to me was, because I'm so bad, but what he said to me was because my body has just made somehow my body's just overcompensated. I don't think about it. I didn't know about the CMT, and I just kept doing the things I did. But he said literally, I can't do half the test for the neurology.
Oh yeah, the
Because
responses
I'm
are so small.
So
Yeah.
bad. I mean, you see my hands and all that. But if you just keep doing what you can do, like she's saying, when you get tired, you stop. I mean, until you get really bad. I mean, now I'm so bad I can't I used to mow the grass, cut the hedges, trim trees, jump up, do all that stuff before. Now I can't do that. But I just did what I could do, and being a single mom, you do what you have to do, and you know.
And there's
Don't
certain.
give up, because that's what I did when they diagnosed me. They gave me a handicap sticker and all that stuff, and then I just gave up. I gained all the weight, and I just feel bad. And now they don't want me to. Now they're finally saying I got a new doctor, and she's finally saying get out there, do as much exercise as you can, and that kind of thing. So, but I think by giving up, I lost a lot more than if I had kept going.
A lot of times those AFOs, those braces, can actually help with the fatigue as well. Some people find them cumbersome to walk with, and others really find that it takes the effort out of the walking. I see some hands going up. Go ahead.
I've been researching AFOs, not for me, I'm here for my husband.
Yeah.
Because I, in watching him, feel as though his gait is really fatiguing. Where do you go for the right AFOs? I mean, there's some that are, he had them and he gave up on them because they were so stiff. Now I've gone online and there's a company, unfortunately, it's in Las Vegas. And they're very flexible. I mean, how do you know which are the right ones for you?
Yeah, you probably shouldn't have to go to Las Vegas for them.
Where do you go to get,
Yeah, there's many places that make them, and it really depends on what's weak. If it's just the foot, if you find that your knee's buckling a little bit or things like that, there's many different types. There's what we call sort of floor reaction braces. So it sort of comes around the front here and pushes on the front to almost keep the knees locked. So there's many different types. So if the knees are buckling, when you're standing or trying to go up things, that provides some resistance to that buckling. And if they're fit properly and they actually...
So where do you start?
I have a guy.
Would you say you have a guy?
Yeah.
Okay.
I went to your guy.
Yeah, an MDA clinic's a great place to start.
I went to your guy and they were great. They
Yeah?
fitted me perfectly and they were fast and the braces are great. So
Yeah.
I recommend your guy too.
Yeah, did he come down and see you? I don't remember.
No, I saw somebody in his office.
Okay.
He wasn't there.
Yeah. Oh, right.
So who is your guy?
Darren Donnelly. He's
Neops.
yeah. He's a really
Yeah,
nice guy
my
too.
son went to-
Yeah, he's a really good guy, and
Where is he?
In Branford?
yeah.
In fact, he's somebody.
He has a
I
couple of
could
different-
contact, see if he can
Oh,
help.
wonderful, that would be
In
great.
fact, I was going to tell everyone, one of the things I was going to talk about is the CMT has a new partnership with Allard, and they're the makers of the toe off and the blue rocker braces.
Yeah,
So they
yeah.
have a new corporate partnership with them. And they didn't have anybody listed for our territory yet, but I'm gonna try to find out, because if I can get a hold of, you know, this territory's rep, I can have him or her come speak to us, so I'm on that too.
Thank you.
Oh, good. Thank you, that's great.
One thing I just, like to tell people is that when you go for AFOs, be persistent, because when I first went, I was having all kinds of pain on the balls of my feet.
Mhm.
I kept going back. They cut them back behind the balls of my feet, and I've had the same AFOs for 25 years. They've never broken. I've got the ones that have the Gillette hinge, and a lot of times I don't know I've got them on.
Yeah, you walk pretty good.
So, if you're hurting, don't just say, well, I can't wear AFOs, I'm going to put them in the closet. Go back to the guy and say,
Right, absolutely.
this is hurting here, this is hurting there, let's work with it.
Fix it, yeah.
They often don't get them right the very first time.
Stand
Ankle foot orthotic.
Ah.
So,
Learn something new every day.
yeah. So, but absolutely, they go back and get them adjusted because they can adjust them.
I have to get new ones.
Yeah.
Right, the foot orthotics.
Yeah, and sometimes as it progresses, they may get a little loose on you, and so they're not quite as supportive as they once were. But they can adjust them up to a point before you need new braces.
They also just about eliminate ankle sprains. How many people sprain
Right,
ankles?
right.
I mean, that to me is the benefit.
Absolutely.
You don't have to worry about spraining your ankles anymore.
Yeah, so up on the grass, make sure you don't go like that.
Mm-hmm.
Yep.
Absolutely.
If I could just, when we were talking about clinical trials, Michelle and I learned about this, and Ruth Ann learned about the CMTA's new, it's called STARS, that's the Strategy to Accelerate Research, that's what STAR stands for. It's called the Transformation Project, and it's their initiative to have adult human stem cell testing to find effective compounds to treat CMT. And it's basically, where it just takes the adult human skin cells, transform to iPS cells, transform to Schwann cells. You could probably explain this better than I could.
Yeah,
But,
Schwann cells are what makes the myelin, the coating on the
Right.
nerves.
Like they say
So-
the stem, you have a baby and you save the what's
Oh, the umbilical cord.
something.
Yeah, this is different. This takes it from the hand.
Yeah.
It says by using cutting-edge technology developed at the University of Wisconsin Weizmann Center, live human skin cells can be transformed into cells that can be tested against pharmaceutical compounds for the purpose of finding candidate drugs for use in human clinical trials. So they're embarking on this groundbreaking research project to rapidly accelerate the drug development process in search of a successful treatment to slow, stop, or potentially reverse the progression of CMT. So
Yeah.
this is exciting.
Yeah?
Yeah, the NIH does pours tons of money into studies. So, and you can get most of the information right on that clinicaltrials.gov website. So it's worth looking at, every now and then. Is that where you found this, or?
No, this is the CMTA website.
Oh, this is on the CMT website.
Yeah, I
Okay.
hope everybody, if you haven't already joined, please join. It doesn't cost anything. Just go on, click on, join the Connecticut group, and you have access to all this information. Plus, whatever maybe is going on with our group, I'll post it. So, but yeah, it's very informative.
Yeah.
How do you find a general practitioner or internist or something like that that knows a lot about CMT? I have a problem, my doctor died, so I have to find a new
Yeah.
general practitioner. And my other doctor knew everything.
I don't know the answer to that one. My doctor moved to Florida, and I had to find a new one, and I haven't
can
found
move to Florida.
one I'm happy with yet. So, I'm not sure the answer to that
Yeah?
one. Yeah.
I thought maybe you had a buddy.
No, I don't know a guy for that one.
Maybe that's a project that this group could start, is to do a survey of doctors in Connecticut.
Yeah, and if they feel comfortable taking care of CMT patients, yeah, absolutely.
Not
My
many of
doctor
them,
was so up on that.
not many of them know much
I
about
was
it.
gonna
Yeah.
say you don't. I was gonna say you don't.
That's why I asked
Any
about the
like that
origin,
right now.
because it seems to be such a popular disease, and
Yeah, it's very
many
common.
people have it, but
Right.
there's not so many doctors that know about it.
Yeah, you're right. You're right, and I think podiatrists are very familiar with it, simply because they see the foot deformities. Sometimes they end up in the podiatrist's office first, or the orthopedist's office first, with the sprained ankles and things like that. And then sometimes they get directed towards a neurologist, but still the primary care is the front line, and some feel more comfortable with it than others. Yeah.
Are you involved with the muscular dystrophy clinic at Yale?
Yes. Yeah.
Okay, so right now there's two. There's one at UConn and there's one at Yale, is that right?
Is the MD? I thought just also was at. MDA for the
When I
children.
met you, Dr. Felice was at the UConn Health Center.
Right,
Is
right,
that
but-
still there?
Well, Dr. Felice and Dr. Whitaker moved to the Hospital for Special Care. I'm not sure if the MDA clinic is continued there. I believe the children's MDA clinic has continued there, but I'm not sure about the
So
adult.
Yale is the only place in Connecticut right now, you think?
I know Yale is one. I'm not sure if it's the only one.
Okay, because when I first started going to UConn,
Yeah.
I mean, I was blown away by, in one day I would see like 8 different
Right.
specialists.
The multi-specialty.
And then I think it was Dr. Goldstein
Yeah.
that
He started.
started at Yale, and I went there and
Oh,
I
okay,
basically
okay.
saw one person,
Right.
Dr. Goldstein, and he said, yeah, you got this, what do you want? And so I was kind of disappointed at the time, and this was years
Right.
ago. I don't know what's happened to the clinic since then.
Unfortunately, not too much as far as the multi-specialties.
Right.
We're trying to get a multi-specialty clinic up and running for Lou Gehrig's disease. And maybe if that gets off the ground, then we can start expanding it.
I mean,
but
I saw a neurologist, I saw
Physical
a physical
therapist.
an orthopedic person, a speech
Yeah.
therapist, an occupational therapist, a nurse.
yeah,
all in
one-stop
one day.
shopping. Yeah,
Right.
it's great.
I mean, it was fabulous.
You're right. You're right. When I was a med student, I rotated up there, and I couldn't agree more. I was blown away. Dr. Felice really did some great things up there, getting that all organized.
Get Dr. Chamberlain, he'll get it done.
Yeah.
You don't know.
I don't know. No, that doesn't mean anything.
He's an endocrinologist.
Oh, okay.
Children's. He can do anything.
And there is a pediatric MDA clinic at Yale now too. Well, it's at Long Wharf, but it's sort of Yale satellite.
Do you know
Parking's
Dr. Marsh?
easier. Dr.
He's
Marsh?
pediatric.
No, I don't know him or her. I don't know
Him.
him. Okay.
I haven't seen him in years. But I noticed that.
Good, well, thanks, guys.
Thank
Thank
you.
you.
Yeah.
Thank you very much.
No problem.